My name's Dean and I'm a social care assessor and I work part of Care Direct Plus Northern, so that's based in Barnstaple. We currently do telephone assessments for anybody that is over the age of 18. And we don't do any face-to-face visits. So recently we've been asked within our role to kind of have a look at are there any different ways that we can support people that are accessing our services and be more focused on their journey and what's important to them and make that journey as easy as possible through our system. Recently we had I received a call in from a community matron who was currently supporting somebody out in the community. And what she had found in her professional judgment that the person could have done with some more social input. So she was basically requesting daycare for the gentleman. So normally what we would have done, we would have taken obviously a professional judgment, we'd have had a look at that, and that can lead you to looking at a solution or starting with a solution and then working back towards the assessment. So what we've done is challenged ourselves to kind of park that solution and have a very just open conversation with the person or a family member and move in and just to see what their view of this situation is and how they would like us to support them. We've had a conversation with the wife. She's expressed some interests that her husband has had and what support was working at the moment for him. And she's kind of guided us on what would best meet his needs and what he would enjoy doing, rather than being focused on the day centre that somebody advised on initially. He did have a few hours a week where it was sort of like replacement care that had been put in place, where he went out one-to-one with a carer and kind of revisited or done activities in the local community that might have been revisiting kind of paths where he used to walk his dog or interests that he's had throughout his life. And that was something that was really important to her. She also helped me identify that he was quite a shy gentleman and that putting him in a day centre facility wouldn't really meet his needs, wouldn't have any value to his life at the moment. If we were going back into old process, what we would normally do would be a telephone call to the person, but because we were trying to do things and be a little bit more person-centred, I kind of thought it would be a good opportunity to kind of go out and visit the environment that he's in, just to make sure that we haven't missed anything or missed any other things that we could kind of support them and make the whole experience kind of not a one-stop shop, but we've looked at the whole picture rather than just focused on one little element of their life and then to try and eliminate them coming back into the system repeatedly. So I've gone out and had a chat with the family. That has enabled me to kind of just identify and tweak the support that we've got just slightly for it to be more centred and cover everything. So on that visit I identified some issues around equipment or a conversation we've had around kind of equipment. So from that I've then managed to pull on an occupational therapist. So normally what we would do is make a referral to our occupational therapy team, and that would sit in a waiting list. So I've managed to go in and have a quick chat with an OT. They've come out on a follow-up visit with me. We've had a look at the issue that was initially said, and they've come up with some ideas. And that's actually then prompted something else as well that they've identified using their expertise and their knowledge of equipment. And we've managed to then put in a couple of additional pieces of equipment for this person. Through the whole period I've obviously kept contact, and I've obviously told them that I'm centre point with this and overviewing everything, and not at any time have passed the person on to another team. So I've kind of stayed very central to everything. So point of call would be me, which is slightly different to our old process on what we would have done, because she would have popped from our service into another service, maybe then come back if it needs to be reviewed again for the care, or just been passed over to somebody totally different.